Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. I am here today for a very exciting podcast with my very stylish and animal-coated co-host, Dr. Millicent Rovelo. How are you doing?
I'm okay, but just to clarify before the PETA folks come after me, I'm not coated in animals. I just have animal prints in homage to the animals that I very much honor.
No, you are not coated with animals. If you were, they'd be alive and running around like your cats who like to just sit on your head and your lap and all that. No, you look great. You're obviously coming from a session of patients, and I'm sure they were all very impressed with your look. Yes?
They did. I got a few compliments.
Yeah, I like it. I am in the traditional black scrubs, so there's that.
There's that.
Anyway, we're here today to talk about the way that plastic surgery operations age.
Yes, because this is a question I had very recently about basically what's going to happen to my butt after I put all this fat into it. More specifically, when I'm bouncing around the nursing home at age 70 with the rest of my friends that have had their butts done, what's it going to be looking like?
Yeah, and it's a great question. I mean, I get questions all the time about how do noses age? How does this facelift age? What happens to my breasts if I have to breastfeed? There's a lot of questions. So I think we should kind of go through generally what happens with aging plastic surgery operations, and then we can hit some specifics like the BBLs and the breast implants and lifts, because things change.
Things definitely change, and the body that you have in the 20s is not going to be the same body you have when you're in your 60s and your 80s. So yes, things change.
And the operations change. How they heal initially gives you a good idea of sort of what it's going to look like over time. But certainly, let's take, for example, your friend who's concerned about her butt.
Yes.
Butts in general get saggy, deflated, and
they fall. I mean, they are no different than the breasts. The same way that your breasts will fall over time, and the same way that large breasts will tend to fall more because, gravity is a scientific fact. And the more the mass, the more they're going to fall with the effect of gravity. So the larger the butt, the more it's going to fall.
Yeah, and that's okay. You just have to kind of know about that. And it doesn't happen overnight. These BBLs that everyone's doing, the Brazilian butt lift, where fat's taken from pretty much wherever you can get it and put it into the butt to make it bigger. I think that this is it's an interesting aging conundrum, because you are adding the volume, but you're also adding some structure with that fat grafting, which tends to be good for the butt.
It is good for the butt, maybe. I'm going to give a caveat on that. Because if you're doing a BBL on a young 20-year-old patient, they probably already have good skin. They don't need structure to their butt. They might need some volume, but if they are not a weight loss patient, they haven't had a couple kids, they're otherwise young and healthy, they don't need structure. Maybe they just need volume. But if you have someone that's a little bit older or they've had a history of weight loss, then they do actually need structure. But then they're already in a kind of precarious position because they've started out with kind of crappy skin.
Yeah.
So it's going to just fall as well, but with some more volume. So you can stuff that volume into your push-up jeans and, have a look the same way that you'd push up your implants or your breasts with a bra. So there's garments that can help you. But yes, time, age, gravity are always going to win. And so let's talk about that with just, as you said, in the spectrum of general plastic surgery, how things age. And that's my quote, time, age, gravity. Not to mention quality of skin. So those four things are going to be what affects you over time.
Yeah, and also you have to remember that as we age, our bodies stop making certain things, like the collagen chains. Collagen is a very large protein component of skin and soft tissue, and the thing that makes collagen high quality is longer chain collagens, where the proteins are lengthy and robust, and as we get older, those chains get shorter and shorter. And that's just it's a fact of life, and that's why people's skin looks worse when they get older. And there's a very clear physiologic connection to why the aging happens.
Right. The skin thins, it loses its elasticity, and so it's going to stretch out a lot more than it did when you were younger.
Yeah, and these things are like very obvious.
Yep. I mean, it's part of the aging process. And so what does that mean if you've had a procedure done? So maybe let's just go head to toe. So let's start with your noses. What does that mean for your noses?
Noses are interesting. In the past, back in the 80s and 90s, when I was, coming up through the ranks of this specialty, the noses aged very poorly because rhinoplasty was not a structural event. It was a destructive event. It was removing the hump. It was taking out cartilage. It was cutting things without any grafting. And as grafting has been introduced into nasal surgery, the noses age better.
They age better because they have more structure. They're less likely to warp and twist over time.
And to collapse. And that's sort of the big thing, is that you don't want the nose to collapse in on itself so people can't breathe.
Right.
And they need rib grafts, and then they become a J. Calvert patient. So that's kind of the deal, right? But with that said, I think noses still have some aging to them. There is a question of how much a nose will grow after a rhinoplasty. If you've done a septoplasty and taken out the growth centers of the septum and the nasal, the internal bones, you're not going to see more growth, because in general, people's noses do grow untouched by trauma or surgery. Their noses do continue to grow as they get older.
They do grow. Look at your grandparents. Look at your grandpa. His nose is not the same nose he had when he was in his 20s. So they definitely grow. They get longer, and they droop more at the tip. They sort of lose some of that tip support.
And if that's the case, then obviously after you operate, those things may do better. Especially if you put in some grafts and make a stronger nose, then who doesn't want a stronger nose? And but I will add to that. We know that after rhinoplasty, noses are not actually stronger. They are weaker because you've disrupted some of the structure. Even in the preservation camp, where you've kind of disarticulated the entire nose from the face, it's going to be weaker because it's no longer attached in its natural way. So even if it's been a push down or a let down technique in the preservation, there's no way that nose is as strong as it was prior to surgery. But I think with the newer techniques that you're going to have better aging of the nose.
So does every person who get a rhinoplasty, are they signing themselves up for a revision in their 50s and 60s?
I don't think so. I think not, actually. I mean, I've watched, there's a rhinoplasty revision that I did in 2010 that I look at every day, and that nose happens to be on my wife, and her nose hasn't changed really since 2010. It's kind of been stable. And even back then, I didn't do as much grafting as I do now. So I think that with the new techniques, people are going to be much happier with their rhinoplasties.
Okay.
So let's move to the face.
Let's move to the face. As you know, if you are a listener of this podcast, we like to talk about facelifts in younger patients and what that means and why you might want to do that. So we do have a cohort of patients that are getting facelifts in their 40s. And that is always a question that comes up. When or if am I going to need another facelift? If you're doing a facelift in your 40s, the answer is yes. If you do care about your face, and obviously you do because you're having a facelift in your 40s, then this is not your last facelift. Because again, changes in your skin, changes in the skin quality, aging, gravity, all of these things continue to work. Just because you've had a facelift, you haven't stopped the hands of time from continuing to work on your skin and your face. But you have reset the clock. So now when you're in your 50s, you might look like you should have looked in your 40s. And so the facelift is not going to be a dramatic facelift that you would have had if you hadn't had one previously. It's just a little more nip tuck, keep you refreshed, keep things looking good. But yes, you will need another facelift.
I'm going to one-up you on that, though, because I think that even though you may need another facelift, as you said, it won't be this big dramatic deal. I think it'll even be different because once you've had a facelift at a young age, you're never going to age like an old lady. Like you're not going to get old lady face or old man face. You're just going to avoid that type of aging because if you've had a good SMAS facelift, whether it's a deep plane or mastectomy or whatever, if you've had a good, solid SMAS facelift, you've now changed the ligament kind of makeup of the face such that you don't really have the points that are present naturally to age around. So I don't think you're ever going to get big jowls. I don't think you're ever going to get, you'll still get descent of the tissues. You'll get thinning of the tissues, and you'll need the skin to be redraped, et cetera. But I just think that there's so much benefit to doing the facelift early.
There is. And we can't say it enough. We are fans of that on this podcast. There are a lot of benefits to doing an early facelift, but it's not going to be your only facelift. So just keep that in your back pocket.
Definitely. With that said, let's move down to the chest. What happens, Miss Breast Expert, and by the way, breasts come in all shapes and sizes, and there's all sorts of quality of skin and weight loss issues. So it's very hard to generalize an aging of the breast, but you can give us some general pointers.
Well, let's start with what happens with breast implants. No matter what age your breast implants are put in, whether you're 20 years old with perfect skin or 40 years old after having a couple babies, they are going to age over time. Now, if you started out with breast implants and you were fairly small breasts and your skin was fairly tight, your breasts aren't going to age to a significant degree for many, 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 many years because you just don't have a lot of skin. But if you were someone that started out with large breasts or breastfed and had a lot of loose skin afterwards, maybe you had a lift when you did your implants, that skin is not good quality. And no matter how much you remove to do a lift, the skin that's left behind is not good quality. And then even though you may need an implant to give you the volume that you're lacking, that implant is still placing pressure on that kind of crappy skin, and it's going to keep aging it. So if your skin is not great, I do tell people you're going to be getting a revision sooner rather than later. It's not a big deal. If you like the size, the implants sort of stay where they are, but we'll be coming back and taking more skin and taking more skin. And if you reference back to the podcast we just did about large implants, now you're really going to be coming back a lot more than if you had smaller implants. Large implants do not age well, especially on the skin. It's going to stretch it out, and you're going to be back for that revision breast lift much, much sooner than if you had smaller implants in place.
Yeah, for sure. I mean, you have to kind of consider every situation. What about the mastopexy patient who's had an anchor scar, a full-on mastopexy with the around the areola, down in front, on the breast, and then the incision in the inframammary fold? What's your experience with the aging of the mastopexy patient or the breast reduction patient?
It's not bad. They're going to age, of course. And I did have a patient recently who'd had a mastopexy 20 years ago, and she still said, she's like, oh, they're still way better than they were before I did the mastopexy. We were revising it. Obviously, we were doing it again. But even she said they're still a million times better than they were. So, yes.
That's a lot. A million times better.
A million times better.
A gazillion times better. That's awesome, though.
Yeah. So you will never go back to where you were. It's the same thing with a breast reduction. Even if you gain weight, you will never go back to the size that you were, and you're going to maintain some degree of that lift, but you may need a touch-up in another 10, 15, 20 years.
Yeah, that's been my experience. I've been around long enough that I've had my reduction patients come back, and they kind of stay where you put them.
They kind of do. They get a little bit more skin on the bottom part of the breast, a little bit of bottoming out, but they more or less are where you put them, aside from massive changes in weight or pregnancy or anything like that. I will say the one thing that is a challenge with the aging breast patient, particularly the aging breast implant patient, is how breast implants look on a 70, 80-year-old patient. Because the ideal breast implant sort of fits hand in glove with the skin, and it's draped perfectly by the skin. The skin drapes around that round implant, and you have this beautiful breast. Even if you do a breast lift or a mastopexy and you remove extra skin in an older patient, it's still hanging from other places in a weird place. It's not going to just drape and form this perfect circle around the implant. Those are challenging cases. The implants in an older patient, don't always behave how you'd want them to behave.
Yeah, I mean, typically you need to do some sort of update as you go through the decades. I have patients, I just tell them, like, look, every 10 to 15 years, we're probably going to need to revisit how we keep these breasts looking great.
Right. And it's possible. We have our 70, 80-year-old breast implant patients, and ain't no chance they're taking those implants out. They got cruises to go on. Totally. They got men to meet. Those implants aren't going anywhere.
I had a 76-year-old come in for a primary breast augmentation. She was like a equestrian, and she's just like, I think it'd look better for my riding competitions.
No way.
If I, basically had some boobs. And I was like, okay.
You're not wrong.
Why not?
Better late than never.
And, interestingly, because we really designed that operation very carefully with not a gigantic implant, one that really fit her breast, like, it turned out really beautiful. And she was totally excited over it. And for her competitions, she felt she looked better. And I was like, great, that's what we did. And it works. I mean, you have to just, it's always about, being sensible with with sort of these approaches. Let's move down to the tummy and the abdominoplasty, and then we'll talk about liposuction in general. But how about abdominoplasties? How do they age?
They age really well.
They do.
They age really well. If you can maintain your weight after a tummy tuck and you don't go on to get more kids and get knocked up again, pregnant again. Forget I'm not chit-chatting with my girlfriends. If you can avoid a pregnancy and you don't gain significant amounts of weight, that tummy tuck will last you for the rest of your life. Yeah. Once that extra skin is removed, it's gone. I mean, it'll get a little bit looser over time, but with a tummy tuck, you remove a lot of tissue. So if you have a good result right away, it's going to more or less stay if you kind of maintain it.
I totally agree. I see that on my patients. The thing that does happen is they will, if they gain weight, they'll get like these little side cars at the end of the incision, where you're just like, what are you growing there? Should we suction those out a little bit?
Because it's like the only place that they can add fat is because everything else has sort of been taken away.
Yeah, people that's a big thing with if I get liposuction here, will I, gain weight in other places? I said, no, if you gain weight, the other places that haven't been suctioned will grow more. It's not that the fat gets up and moves to Topeka, Kansas. It's just that those areas still have all their fat cells because we only have a limited number of fat cells in our body. So when you take them away, they're gone.
They're gone.
And that's it. And you're not going to grow more.
But the ones you have can get larger.
They can get as big as they want because it's all about, there's a little cell, the nucleus of the cell, and then there's all the cytoplasm, the volume, the fluid structures of the cell, and you can get as big a lipid bubble in that cell as you want. It can be huge. So your cells can take on as much fat as you want to feed it.
You can definitely eat your way back through your liposuction for sure.
Totally.
But if you just gain a little bit of weight, you may see it in areas where maybe you didn't gain weight before just because you have decreased fat in the areas that you did the liposuction. So you're right. The fat does not move. It doesn't travel from your hips to your arms. But you may gain weight in a little bit different area than you would have before just because that's where there's more fat cells.
Totally.
Now, I will say also with liposuction, for the most part, if you stay about the same weight, your liposuction won't change. But I've noticed if you've had a really aggressive liposuction where they took out a lot of fat all the way close up to the skin, it might look good and smooth, up until you hit the menopause age. And then as your skin starts to lose elasticity, you're going to start seeing some ripples and divots because when your skin was thicker, it was camouflaging some of the irregularities from the liposuction. But then as the skin gets thinner, you start to see some of the lumpy bumpiness from the liposuction.
Yep, I 100% agree. But that's why, again, I remember I think it was in high school, I saw an article about Sophia Loren, and they asked her, how do you stay so beautiful and you're aging so gracefully? What's your secret? She said, get a good plastic surgeon and stay with them.
God bless her.
And she's right, because the thing is, people jump around from plastic surgeon to plastic surgeon. Oh, he's an expert in this. He's an expert in that. Okay, maybe. But like I have patients that I've done literally every plastic surgery operation on since the time I got to California in 2001. I have patients who've had facelifts, tummy tucks, breasts redone, everything. And you start to realize that if you get a plastic surgeon who has your demeanor, has your appetite for aesthetics,
right.
then you can get what you want. And I'll tell somebody that's not something I do, but like we're plastic surgeons.
In general, the average plastic surgeon can do
absolutely
the average amount of plastic surgeries that are available out there.
Yeah, I mean, I do a lot of facelifts, I do a lot of rhinoplasty, and I do a lot of breasts. But I also do a really mean tummy tuck. And you know what I don't do? I don't do medial thigh lifts. So if we could just put that down right now, that if you're thinking, I'm going to go to Dr. Calvert for the medial thighs, no. We can just, you can go anywhere else. And in fact, I don't think anybody in Roxbury would want them coming there either. I think Chopra even said,
Chopra's done.
No more medial thigh lifts.
Yes.
They're just rough.
In general, if you have a plastic surgeon that you like and they've done a good job for you in one surgery, that means they're probably a good plastic surgeon and they'll do a good job for you in another surgery. That being said, I don't really do rhinoplasties, so if someone comes to me for a rhinoplasty, I'll say, I know a guy, but that's not what I do. And so hopefully your plastic surgeon would say that to you as well.
Yeah, I mean, that's how it should be. And there are things also that we do that like we don't really advertise a lot. Like I've done 4 BBLs in the last month. Do you know that?
I know. I've seen you.
Like I have done 4 BBLs in the last month.
Right, because it's part of the deal. If you're
not on my website.
If you're doing a liposuction and you're doing tummy tucks, patients want that fat to go somewhere, and you don't want to waste it, so you might as well put it somewhere. Which brings us to the start of this podcast. What happens to the aging BBL? We haven't answered that question yet. Does it just fall down to your knees?
No, I think the aging BBL.
Yes. It depends how big it is.
Is variable. Well, there's BBLs come in a lot of shapes and sizes, Dr. Rovelo.
Those large ones, I think they're going to be down to their knees by the time they're in their 70s and 80s.
They're very scary looking to me. I think if you do a reasonable 200, 300 cc augmentation on somebody that's 115, 160 pounds, somewhere in there, or you put some fat in to make it look better and fuller, not an issue. I think when you do these 1,000, these 500 cc, 700 cc's per butt cheek, you're going to have some issues with that.
You're going to have some issues. The same way with the breast implants. A patient that has a 250 cc implant, those breasts and those implants are not going to age the same way as that patient that has the 800 cc implant. It's the same for the BBL. And by the way, you and I have a very different patient population. 200 cc's. That's cute. 150 pounds. That's cute.
I always say the smallest surgeon in Beverly Hills has the biggest patients of all time, which you do. You get the people. I am blown away by how you take these people who've lost weight and they have skin that literally looks like you could cover the table with it, and
their skin has skin.
And yeah, it does. And you take them down to like these like normal looking people. That's and it's very powerful for them.
Oh, it's huge. Yeah.
It's very powerful, and that is not easy work, and it's very difficult. And as much as I'm trying to do minimally invasive everything, you are doing the most maximally invasive. You do the most maximally invasive operations known to man today.
I would agree with that. If you're interested, I have a maximally invasive fellowship that you can do. Forget your minimally invasive fellowship. But so, I mean, if you have a large BBL, you put a lot of fat in there, it's going to fall, it's going to descend, but that's why we have butt lifts. I mean, we have a surgery called a butt. So, okay, let's clarify some terms, because a BBL stands for Brazilian butt lift, but it's not a lift in the same way that a breast lift or a butt lift is cutting the skin, removing skin, lifting things up. That's a surgical butt lift or a breast lift. A BBL is getting sort of the appearance of a lift by filling it up with fat, but there's no actual cut on the skin. You're not actually lifting anything directly. But there is a procedure called a butt lift where you do make an incision across the buttocks and the back, and you remove extra skin and you pull it up and you fasten it in place. So that's where I see these larger BBLs going. And even without a BBL, over time with age, people need butt lifts because things fall. That's gravity. So that is the option for the 80-year-olds in the nursing home walking around with their sagging BBLs.
I've done them. I've done those butt lifts. Yeah, they work well. Just for our listeners at home, the term Brazilian butt lift really was coined by Tony Griffin, who is a plastic surgeon in Beverly Hills, who was on a show called Extreme Makeover, which was when I was a resident, basically, in Pittsburgh. I saw it, and he called it a Brazilian butt lift because he was, basically paying homage to Louis Toledo, who really was the guy that showed that you could take fat and inject it. And in his book about he didn't call it a Brazilian butt lift. Really, Griffin put that name on it on Extreme Makeover for sure. But Louis Toledo was the guy that really found that you could inject fat and do these fat augmentations for the buttocks, and that they would work. And he did caution 300 cc's was kind of the max. He said it could get dangerous beyond that. And there was a ton of controversy for a while about injecting too deep and do you need to use ultrasound and all this stuff about how to do it. And in the end, you can be safe by using the proper instrumentation and staying superficial. And that's really the bottom line.
That is. Is that it? Is that intentional? That's the bottom line?
That is the bottom line. That would be a good name for the practice, for somebody that's interested in doing just BBLs.
The bottom line.
I think, you know what? I was with a guy, now that you said that, in San Diego at the AAFPRS, who sent me a license plate of, he's an ENT guy, and the guy in his practice is a plastic surgeon. And I think he sent me a picture of his license plate that said BBL King. I'm gonna have to find that. That's got to go up on our Instagram.
Yeah, that's a good one.
Yeah, I'll find it and show it to you. It was so classic. I was like, that's a commitment.
Yeah, and a little riff on BB King.
BBL King. BBL King. I like it. That's good. Well, I think that covers it all in terms of aging plastic surgery. Anything else about that, Dr. Rovelo?
Nope, that's it. Just know that any plastic surgery you have, it is a commitment. If you want to maintain your results, it is a commitment. Nothing is necessarily one and done, and you're going to look like that for the rest of your life. If you want to maintain your appearance, it's going to take a little work.
Yeah, and just follow Sophia Loren. Get a good plastic surgeon and stick with them.
We agree with that, for sure.
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.